Heart disease is a leading cause of death. It claims more lives each year than any other illness, making it a critical public health issue. Despite advances in medical science, the battle against heart disease continues to be a challenging one. Millions of people live with it. These individuals come from all walks of life, and the impact on their daily lives can be profound. From managing medications to frequent doctor visits, living with heart disease requires constant vigilance and care. But a new study reveals a hidden danger: sleep apnea. This condition, often overlooked, can have serious implications for those already battling heart disease. Sleep apnea is characterized by repeated interruptions in breathing during sleep, leading to poor sleep quality and other health issues. This condition disrupts sleep and harms the heart. When breathing stops, even briefly, it can cause a drop in oxygen levels, putting extra strain on the heart. Over time, this can lead to worsening heart conditions and increased risk of heart attacks and strokes. The study found that sleep apnea is common in heart disease patients. In fact, it is estimated that up to 50% of people with heart disease also suffer from sleep apnea. This overlap suggests a significant, yet often unrecognized link between the two conditions. It can make their condition worse. The additional strain on the heart caused by sleep apnea can accelerate the progression of heart disease, leading to more severe symptoms and complications. This makes it even more critical to address sleep apnea in these patients. This discovery highlights the need to screen for and treat sleep apnea in those with heart disease. Early detection through sleep studies and other diagnostic tools can help identify patients at risk. Once diagnosed, effective treatments such as CPAP machines can significantly improve outcomes. Addressing sleep apnea could improve the lives of countless individuals. By ensuring better sleep quality and reducing the strain on the heart, patients can experience a marked improvement in their overall health and quality of life. This can lead to fewer hospital visits and a more active, fulfilling life. It is crucial to understand this condition and its impact. Public awareness campaigns and education initiatives can help inform both patients and healthcare providers about the importance of recognizing and treating sleep apnea, especially in those with heart disease. Early detection and intervention are vital for protecting heart health. By integrating sleep apnea screening into routine heart disease care, we can take a proactive approach to managing both conditions. This holistic strategy can lead to better health outcomes and a brighter future for those affected by heart disease. Sleep apnea is a disorder that disrupts sleep. It is a serious condition that affects millions of people worldwide, often without them even realizing it. The disorder is characterized by repeated interruptions in breathing during sleep, which can lead to a host of health issues if left untreated. It causes breathing to repeatedly stop and start during the night. These interruptions can last from a few seconds to minutes and may occur 30 times or more an hour. This constant stopping and starting of breathing can prevent the body from getting enough oxygen, which is essential for overall health. This happens because the airway becomes blocked. The blockage can be due to various reasons, such as the muscles in the throat relaxing too much, the tongue falling back into the throat, or excess tissue in the airway. When the airway is blocked, it makes it difficult for air to flow into the lungs. The most common type is obstructive sleep apnea. This type occurs when the muscles in the back of the throat fail to keep the airway open. It is more common in people who are overweight, have a thick neck, or have a family history of the condition. In obstructive sleep apnea, the muscles in the back of the throat relax too much. When these muscles relax, the airway narrows or closes as you breathe in. This can lower the level of oxygen in your blood and cause a buildup of carbon dioxide. This blocks the flow of air. When your brain senses that you can't breathe, it briefly rouses you from sleep so that you can reopen your airway. This awakening is usually so brief that you don't remember it. You might snort, choke, or gasp. This pattern can repeat itself 5 to 30 times or more each hour, all night long. People with sleep apnea often snore loudly. Snoring is a common symptom of sleep apnea, but not everyone who snores has the condition. The snoring is usually loudest when you sleep on your back, and it quiets when you turn on your side. They may gasp for air while sleeping. This gasping or choking can wake you up and make it hard to get a good night's sleep. It can also be very disturbing for your bed partner. They also feel very tired during the day. The repeated awakenings associated with sleep apnea make normal restorative sleep impossible. People with sleep apnea often experience severe daytime drowsiness, fatigue, and irritability. This is because their sleep is constantly interrupted. The lack of quality sleep can lead to poor concentration, memory problems, and a decreased quality of life. It can also increase the risk of accidents, especially if you drive or operate heavy machinery. Untreated sleep apnea can have serious consequences. It is not just a nuisance, it is a serious medical condition that requires attention. If left untreated, sleep apnea can lead to a range of health problems. It is linked to high blood pressure, heart disease, stroke, and other health problems. The repeated drops in blood oxygen levels that occur during sleep apnea can increase blood pressure and strain the cardiovascular system. This can lead to an increased risk of heart attacks, strokes, and other serious health issues. Therefore, it is crucial to seek medical advice if you suspect you have sleep apnea. The new study confirms a strong link between sleep apnea and heart disease. This groundbreaking research sheds light on how sleep apnea, a condition characterized by repeated interruptions in breathing during sleep, can significantly impact cardiovascular health. Researchers found that people with sleep apnea are more likely to have heart problems. These problems are not just limited to minor issues, but can include severe conditions that affect overall health and quality of life. These include high blood pressure, irregular heartbeat, and heart failure. High blood pressure or hypertension is a common issue among sleep apnea patients, which can lead to further complications if not managed properly. The study also found that sleep apnea makes existing heart disease worse. Patients with pre-existing heart conditions are at a higher risk of experiencing more severe symptoms and complications due to the added strain on their cardiovascular system. The researchers believe that the repeated drops in blood oxygen levels during sleep apnea harm the heart. These drops, known as desaturations, occur when the airway becomes blocked, leading to a decrease in oxygen supply to vital organs. These drops put stress on the cardiovascular system. The heart has to work harder to pump blood and maintain oxygen levels, which can lead to increased wear and tear over time. Over time, this can lead to heart damage. Chronic stress on the heart can result in conditions such as cardiomyopathy, where the heart muscle becomes weakened and less effective at pumping blood. The study highlights the importance of considering sleep apnea in anyone with heart disease. Early diagnosis and treatment of sleep apnea can play a crucial role in managing heart disease and improving patient outcomes. Healthcare professionals are encouraged to screen for sleep apnea in patients with cardiovascular issues to provide comprehensive care. Continuous positive airway pressure, CPAP, therapy is one of the most effective treatments for sleep apnea. By keeping the airway open during sleep, CPAP therapy helps maintain steady oxygen levels, reducing the strain on the heart. Patients who use CPAP therapy often experience significant improvements in their overall health, including better heart function and reduced symptoms of heart disease. Alongside medical treatment, lifestyle changes such as weight management, regular exercise, and avoiding alcohol and smoking can also help manage sleep apnea and its effects on the heart. Support groups and educational programs can provide valuable resources and support for patients dealing with sleep apnea and heart disease. By staying informed and proactive, patients can take control of their health and work towards better outcomes. In conclusion, the link between sleep apnea and heart disease is clear and significant. Addressing sleep apnea is essential for anyone with heart disease to prevent further complications and improve overall health. Regular checkups, adherence to treatment plans, and a healthy lifestyle are key to managing both conditions effectively. Several factors increase the risk of sleep apnea. These include obesity, large neck size, family history of sleep apnea, smoking, and alcohol use. Many of these are also risk factors for heart disease. This overlap is concerning. It means that people with heart disease are at even higher risk for sleep apnea. Doctors need to be aware of these risk factors. They should screen their patients accordingly. Early detection of sleep apnea is crucial for preventing further heart damage. Screening early detection is key. Given the link between sleep apnea and heart disease, screening is essential. Doctors should consider screening all heart disease patients for sleep apnea. This is especially important for those with difficult-to-control blood pressure or irregular heart rhythms. Screening can be done with a simple questionnaire. It can also involve a home sleep test. This test monitors breathing patterns during sleep. Early detection allows for prompt treatment and can improve heart health outcomes. Treatment options, CPAP and lifestyle changes. The most common treatment for sleep apnea is continuous positive airway pressure, or CPAP. CPAP uses a machine to gently blow air into the airway. This keeps the airway open during sleep and prevents breathing pauses. Lifestyle changes can also help manage sleep apnea. These changes include losing weight, quitting smoking, and avoiding alcohol before bed. Treatment can improve sleep quality, reduce daytime sleepiness, and protect heart health. Benefits of treating sleep apnea, a healthier heart, and more. Treating sleep apnea offers numerous benefits. Studies show that CPAP therapy can lower blood pressure, improve heart function, and reduce the risk of stroke. It can also enhance daytime alertness and cognitive function. In addition to heart health, treating sleep apnea improves overall well-being. People experience better sleep, reduced daytime sleepiness, improved mood, and a better quality of life. It is a worthwhile investment in one's health. Home-based sleep studies diagnosis made easy. Diagnosing sleep apnea used to require an overnight stay at a sleep center. Now, home-based sleep studies offer a convenient alternative. These tests are simpler and less expensive. They monitor breathing patterns, heart rate, and other factors during sleep in the comfort of one's home. If the test reveals signs of sleep apnea, further evaluation by a sleep specialist may be needed. This confirms the diagnosis and determines the severity. Home-based tests make diagnosis more accessible. Take action. Talk to your doctor. If you have symptoms of sleep apnea, such as loud snoring, gasping for air during sleep, or excessive daytime sleepiness, talk to your doctor. They can assess your risk factors and recommend appropriate testing. Early diagnosis and treatment are essential for protecting your heart and overall health. Don't ignore the signs. Take control of your sleep and your health.